In this video, a physician is demonstrating the delivery of a warm handoff for a patient drinking at a risky level. The physician will review with the patient the findings of an alcohol screen, link the patient's current alcohol use to 2 other health concerns, advise the patient to follow up with a specialist on staff.
How's it going?
Not bad. You said you wanted me to come back in, so I'm here.
Yeah, well, thanks for coming in. I appreciate it. I was looking at the blood pressure that the nurse took today, and it really looks like your blood pressure's come down on that new medication. I'm really happy about that. Are you having any problems with the medication?
I haven't noticed any. I mean, I've been loyal and taking it every day, and I haven't felt any different.
Okay, great. You know, there's one other thing that did come up today that I was noticing, and that has to do with the screening questionnaire that you did about your alcohol use. Do you remember doing that?
Yeah.
So the results of that, when I was reviewing them, it shows that your alcohol use is in the risky category, something that was a little bit concerning to me. How do you feel about your alcohol use?
Whoa. Well, it's crossed my mind a few times that maybe I shouldn't have had that last drink, or in the morning, I've noticed it's a little slower to get started sometimes, but risky, huh?
Yeah, so one of the most important things was that you had more than 14 drinks in a week, which definitely puts you into the risky category. And that's, something that we'd be concerned about in terms of your overall health. I usually think of alcohol use, I compare it to any other sort of chronic condition like diabetes or high blood pressure like we're talking about today. It's definitely something, that we should take seriously, and my advice as your doctor would definitely be for you to cut down or decrease the amount you're drinking.
Whoa. I guess I do drink, but it's how I do business. I'm a salesman. We're sitting around, we have some drinks, that's how we socialize. I don't want to say everyone else does it, but everyone else does it, So I guess I didn't see myself as being unique in any way. I don't know.
Yeah, like you said, that's part of the reason we do this screening, is a lot of people don't realize that their behaviors are as risky as they are. If you were up for it, one thing I'd really like for you to do today is to meet with a colleague of mine named Naya. She's a counselor who could spend a little bit more time talking with you about your alcohol use and maybe come up with a plan about how you might be able to improve that.
Just talking?
Yeah, it would just be talking today. It doesn't take long. It would be about 5 to 15 minutes today. Just a brief discussion with her to, again, talk a little bit more about your alcohol use and maybe identify some strategies to decrease that use. Like I said, I think it's really important for your overall health, especially you're 60 years old, and excessive alcohol use is associated with all sorts of health problems. It might be contributing to the reason that you have high blood pressure, for example. It also, is associated with all sorts of other problems like liver disease, nerve damage, all sorts of other things.
Whoa. Sure.
Okay.
I give it a shot.
Thanks. I think it's really important to your health. Just 1 second, and I'll go grab Naya, okay?